Welcome back. Roxanne Closey with Easter Seals Goodwill is still with us, and we're talking about home health care. Thanks for staying with us, Roxanne.
My pleasure.
So how do people pay for home health? Is it expensive?
So the different levels of care have a different amount that's charged.
Okay.
So when we're looking at the home health care model, that skilled level of care, that is reimbursed by Medicare, Medicaid, the VA, private insurance. Very, very rarely do we have someone that needs to pay for it, like a private pay. So any insurance company, as long as a physician orders it and oversees the care, is paid for by insurance. When you're looking at personal care, more of that companion care, Medicaid does provide resources for individuals who qualify to receive personal care services. Now, something that's new this year is some of the Medicare Advantage plans, those additional plans that people purchase that are on Medicare, will pay for in-home care, that personal care service, to be able to have somebody help them with bathing, shopping, that kind of thing, rather than having to look outside that. And that's something that's relatively new and not everybody is aware of. We do have a fair number of folks who pay for those services privately. They just realize that they have maybe an older mom or dad who need that help, and their child works full time, so they don't have the opportunity or the availability to go and take care of them. So we offer those services as well. Another service we have in Great Falls primarily is our adult day program, and that's a social interactive program that is located at 4400 and Central Avenue, where adults who may not be safe at home alone during the day and they live with a family member or a friend can go and be supervised and participate in the games and so on. So you just kind of think of it is adult daycare, so it's just like a child care, but only for those of us who are older than children.
That sounds great. Yeah. So you've talked about the different kinds of care professionals that are involved in home health. How's that set up and supervised?
So with our home health care, we have conditions of participation that are set by the Medicare and Medicaid regulatory body. So with those conditions of participation, we have to make sure that we have policies in place, we have protocols in place, we're overseeing the care that's provided and making sure that it's appropriate and that it's good quality. We just recently had our Department of Health and Human Services for the state of Montana audit for our home health care survey program, and it went incredibly well. They told us we had a spectacular survey.
That's good news.
Yes.
So what about hospice? I know that can be provided in the home. So what distinguishes that from the other programs?
So hospice is basically when you're looking at making someone comfortable toward the end of life. You're not expecting that person to improve or to get well. So what we need to do then is make them as comfortable and support them as best we can in their home. That is also paid for by Medicare, Medicaid, VA, private insurance, that kind of stuff too. So that's the difference. We still have nurses that go in and take care of them as well.
People have heard the terms palliative care and hospice care. Can you tell us the differences between the two?
Sure. So with palliative care, that's someone who has a chronic illness. So maybe they have heart disease that's being managed with medicine. And we don't really expect them to pass away in the next 6 months or so. We expect that as long as we continue to treat them, they'll stay probably status quo. They might kind of deteriorate a little bit, but with hospice, we don't expect that person to be here based upon their disease process for longer than 6 months. So that would be the difference.
Okay. So can palliative care also be provided at home then?
So at this point in time, that's something we're working with the government. I know that they're looking into allowing hospices to provide palliative care. That's not something that's in place at this point. Recently, there's been some publications and some rumblings that it could be coming soon. I just don't know for sure. At this point in time, the palliative care programs are affiliated with hospitals.
think it's scary for people to think about gaps in healthcare and falling through the cracks. What can people do if they feel like they're in this situation?
If they ever have a question, just reach out and call your provider. You can talk with their nurse. You can call our office. Just call and ask the question, and don't be afraid to ask the question. There are no stupid questions. They're all very important, and we have a very complex system that we're trying to navigate in taking care of individuals in our communities.
Absolutely. When you go into people's homes, are there ever situations in which you might feel like they need more help than you're able to offer?
Absolutely, and that's one of the advantages that we have with the different services. We're able to kind of cross those lines a little bit. If we have a real big concern about an individual, we may want to get our social worker involved, even if that social worker is employed by a hospice program in Butte or in Great Falls. They can go to the home health setting and help assist that family or that patient. Sometimes we go into homes and they're just not safe, and so we need to make the call to Adult Protective Services and make sure that they're going to be okay.
We have time for just one last quick question in a couple of sentences. I'm assuming that you develop close relationships with folks in their homes. How do you train these folks so their relationships are professional and appropriate? Absolutely,
and sometimes it's one of those things that could be easy to cross the line, but we have to make sure that they understand that we're there in a professional capacity and that we're going to take care of them. So when a patient decides that they want to adopt one of my nurses, then we have to say that that's wonderful. We have a great relationship, but I'm here to take care of you.
Wonderful. We'll hope you stay with us. We're going to take a quick break.
Thanks.
We still have more to talk about. Inviting people in your home to take care of you or a loved one involves a lot of trust. So how do you get home health care that's safe and right for you? Stay with us.